Tummy tuck is one of the more transformative surgeries that I do. I do it in combination with liposuction around the torso, which I think is a critical component to achieve the result that patients are looking for. The tummy tucks are typically done to treat the changes that happened with pregnancy or with weight gain and loss. So what we remove is skin and fat, the skin that oftentimes has stretch marks. We repair the muscles that have separated after pregnancy, something that unfortunately you can't do in the gym alone. So liposuction is almost half the surgery, where I do that with patients positioned differently on the table so I can ensure that I treat the entire torso in a comprehensive fashion. And then the other part of the tummy tuck is removal of all of the tissue below the belly button, the part that really gets in the way and bothers most patients. And at the same time, I'm able to tighten the muscles to truly give a flattening effect, to contour the waist, and again, change the entire torso and the entire shape. My approach when it comes to a tummy tuck is to assess the patient's frame and shape, because everybody's different, and the tummy tuck needs to be tailored in a way to bring out the natural curves that the patient has. So I think there's a lot of time spent in analyzing the patient, looking at photos, and planning things preoperatively. Our consultation focuses a lot on the recovery, because the recovery does take a little bit longer than some of the other surgeries. So I try to explain that to patients so they're prepared. I find patients sail through recovery much more smoothly when they know what to expect. For a tummy tuck, I tell patients to not plan on doing very much for the first week, and then it's probably 2 weeks before they go back to work. I tell patients, when you go back to work after 2 weeks, you're not going to feel 100%. It may be more like 4 to 6 weeks before patients truly feel completely like themselves, and even at that point, there's still some residual swelling. I tell patients that when they look at the website, the pictures are taken at 3 months. That's when I feel like 95% of the swelling has resolved. So having a tummy tuck here at our new facility has really changed the experience for patients. It's much easier than going to the hospital. You come here, you see people that you've already met. Patients just seem much more calm, much less anxious to have surgery here. Having this new facility affords me the luxury of having the same team every day. Everybody knows exactly how we're going to do a tummy tuck, and it becomes a very efficient and easy sort of procedure.